Good evening, everyone. Good evening. Welcome to our online CPR certification by Team Away. This foundation and the National Healthcare Providers. Welcome, one and all.
Hi, we're going to get started. We have some others joining in. And I'll just start with introductions and people will keep rolling in here. So welcome. It's 8 o'clock in the morning for me. I know it's evening for you. I'm in the United States. I'm right outside of Washington, D.C. And we're here for CPR, of course. And my name is Kim. I'm a nurse. I'm the medical educator for the DISC Foundation. And the DISC Foundation was created solely to help others save lives. So we're providing free healthcare education around the world, sponsored by the Save a Life Initiative and savealife.com, which you guys are working with. And our goal is to empower 10 million people. So welcome. I'm glad you're here to learn some CPR. So in the United States, our survival rate out of the hospital is about 10%. Oops, I went the wrong way. And in the hospital, it's about 20%. Hold on, I gotta let these people in. There we go. So it's a little bit higher in the hospital if someone would have a cardiac arrest, a little higher survival rate. But of course, we want that to go even higher. I'm going the wrong way again. So studies have shown, of course, that, what is going on with this? I apologize. Let's keep on the same page. I think just because everybody's showing up, I'm getting my page flipped around. All right, back to this slide. Here we go. So in the United States, our survival rate to hospital discharge is around 10%. If you're in the hospital getting a cardiac arrest, having a cardiac arrest, the survival rate is closer to 20%. But that's very low. So of course, we want to raise that. So along with the American Heart Association, we are trying to increase that rate and save lives. So the more people that we can empower with learning CPR and then teaching others, that is going to help improve our goal. And people, of course, have fears of doing CPR if you've never done it before, but we hope that if you practice and learn this skill and keep refreshing your skills, you're going to feel more confident. Of course, we want you to be always looking for a safe scene for you and the other participants, including the victim. And COVID-19, of course, fear of disease is very prevalent right now. But studies have shown just in the year during this pandemic that our first responders are not contracting COVID-19 at any higher rate than the community. So as long as you are using your PPE and a mask, the risk would be about the same. And hopefully people are starting to get vaccines now. For adults, this is our chain of survival. So this is the path that we're going to go through when we are trying to save a life. So the most important thing here, the first step is activating that emergency response system, where here we call 911. So you want to call whatever emergency number you have, whether you're in a facility or out in the community, so that you can get an ambulance there and get them transported to the hospital. If you need to perform CPR, get started right away. Those few minutes, up to 10 minutes, are really, really vital for this person. If you have an AED available, we want you to defibrillate right away too, once that is brought to you. These next 3 steps are handled by our hospital when we take the victim to the ER, or if a paramedic shows up, maybe you have an ambulance with advanced life support if needed. And then after they are in the ER, they're going to have their post-cardiac care and recovery. But we can be responsible for these first 3 steps in helping to make sure that that happens. So what is CPR? This is cardiopulmonary resuscitation, which is combining rescue breathing and chest compressions to support the heart and lung when it is not working by itself. So we're literally pushing on that chest bone when we do compressions, which is compressing the heart, which is squeezing that blood and sending it all throughout the body. And the blood already has oxygen in it, and the most vital organ there is the brain at that time. So we're trying to get oxygen to the brain. So the takeaway point here is start right away. As soon as you feel like the person is not responsive and not breathing, brain damage can start in just a few minutes, and we only have really that first 10 minutes that we need to provide care. So that's crucial to take action while you're waiting for help. So here is an overview of adult CPR. We, of course, want to make sure that we have a safe scene, looking around for any danger or violence or anything that might happen or has already happened. Assess them for responsiveness. And with adults, we just tap really hard on the shoulder and say, hey, are you okay? And see if you got any response or movement. If there is no response, we're going to keep going on to CPR. So first, though, we're going to call your emergency number or tell someone, hey, call for help. If you have a cell phone, you can take that out and put it on speakerphone and call if you're by yourself, and get an AED or send someone to get an AED. Next, we're going to check to see if they are breathing, and just take a few seconds for that. If they are not breathing and not responsive, we're going to keep going on to CPR. So for adults, the ratio that we do chest compressions is 30 chest compressions to 2 rescue breaths. So we're going to continue at that rate until one of these things happens. Either the AED is brought there, and if you have to stop to put the pads on, you can do that. Otherwise, if someone can help you, they can do it while you're doing compressions. Or if you see signs of life, which might be vomiting or a seizure or movement, if the scene becomes unsafe for either you or the victim or the other providers and you need to move, or if you're too tired to continue, if you're by yourself and you've done this for 20 minutes, you might need to stop or take a break. So we're going to check out a video at this time.
Can you believe they're catching the game last night? It was amazing. I thought it was over. I was ready to turn the TV off and go to bed. But they got lucky. They had no business winning that game. Look, a win is a win. Yeah, right. Oh, check him out. That guy looks like he was out on the field. Seriously, though, you think he's okay? I would assume so, since he's out and about, but how can you tell? Hello? I gotta get to the office. Yeah, me too. Yeah. Okay. We'll get those documents over to your office later today, then we can discuss where to go from there. Sound good?
Help! Help! Dad, are you okay? Help! Dad. Dad, please.
Sir, are you okay? Sir, are you okay? Call 911. Get an AED and first aid kit right away.
Yeah, we have this at the store. Dad.
It's okay. He's calling 911. Did your father complain about anything before he collapsed? Or?
He was complaining about not feeling it, but he always complains, and then he just collapsed out of nowhere.
Do you know if he's allergic to anything?
Allergies. Aspirin. He's allergic to aspirin.
Does he take any medication? Or?
I don't think so.
So good. This had a lot of great things in it. This is just in our first step of recognizing and responding to an emergency. So you can see that they noticed something was wrong. First of all, is the first step. And they decide to take action. So instead of just walking by, you know, they're acting as first responders to see if they can help. This gentleman right away was tapping his shoulder and saying, "Hey, are you okay?" Now, in this scenario, this victim was moving around. So if you're moving, you're breathing, you know, but he's checking those things anyway. And so we didn't need to start CPR in this scenario, but you can see he still stopped to help. And then he told the other man he was with to call for help, so call for an ambulance. And then he notices that, you know, this person who came to stand and see what was going on was wearing an apron. So they look like they are working in a nearby store and just came out to see. So that's the one that they picked to say, go get the first aid kit and the AED, because it's more likely that they would have one instead of just picking somebody else on the street who might be out shopping or something like that. So then he's just asking more questions and staying with them to see what's happening. And she's coming back with the AED within, you know, 20 seconds because she was working right there. So that one is a really good example of a great way to start by looking and deciding to act. So now let's check out our CPR video, and then we'll go through the components of CPR one by one.
Hey, are you okay?
After confirming that someone is unresponsive and not breathing or only gasping, assume cardiac arrest and begin CPR.
He's unresponsive.
Ensure the person is on his back on a firm, flat surface such as the ground. Next, kneel beside him and place the heel of one hand in the center of his chest, with your other hand on top. Interlace your fingers and make sure they are up off the chest. Position your body so that your shoulders are directly over your hands. With this technique, you can use your body weight to help compress the chest. Now, give 30 chest compressions. Keeping your arms straight, push down at least 2 inches, then let the chest return to its normal position. Continue to push hard and fast, giving compressions at a rate of between 100 and 120 compressions per minute. For a child, push down about 2 inches. And for a smaller child, you may only need to perform chest compressions with one hand. Next, give 2 rescue breaths. First, place a breathing barrier over the person's nose and mouth. Then, open the airway by putting one hand on the forehead and 2 fingers on the bony part of the chin and tilting the head back to a past neutral position. For a child, you'll only need to tilt the head to a slightly past neutral position. Pinch the nose shut, take a normal breath, and make a complete seal over the person's mouth with your mouth. Blow for about 1 second while looking to see that the chest rises. Take another breath, make a seal, and give a second rescue breath.
1 and 2 and 3 and 4. and
Continue
5
giving
and
sets
6
of
and
30
7
chest
8 and
compressions
9
and
10
2
and
rescue
11
breaths
12
until
13 14 15
you
16
notice an
17
obvious sign of
18
life.
19 20 21 22 23
An
24 25
AED is
26
ready to
27
use
28
and no other
29
trained
30.
responders are available. You have performed 5 sets of CPR and another trained responder is available to switch.
1 and 2 and 3 and 4 and 5 and 6.
You have
7
performed
and 8
5
and
sets of
9 and
CPR
10
on a
11
child.
12
You are
13
alone and need to call
14
911.
17 18 19 20 21 22 23 24
EMS personnel take over.
28 29 30.
You are alone and too tired to continue. Or the scene becomes unsafe.
1 and 2
And the
and 3
AED
and
and for
4 and
safety.
Okay, so that was our overview, and we're headed back to look at the components again. So this was our overview. For children, the difference is that the first step is to prevent arrest. So just making sure that the scenario is always safe for children, childproofing. For children, another difference that just came out here at the end of 2020 was that ILCOR has changed the recommendation to speed up the amount of ventilations that a child will get. So the ratio will be 15 chest compressions for 2 rescue breaths for any age or scenario of child. Doesn't matter if you are by yourself or with somebody else or advanced airway or whatever. So it's just doing it faster because children are more likely to have respiratory arrest first that leads to cardiac arrest. So we're supporting the respiratory effort first. Here are the key points for chest compressions. You want to put your hands in the center of the chest. We just do one on top of the other. It doesn't matter which hand. Compress at a rate of 100 to 120 a minute. And the depth should go by the depth of the chest. So this is by the size of the person. So if we look at them from the side, if they're laying on the ground and this is their chest, we're just pushing about 1/3 of the way down. So children are smaller, of course, and then adults, we would go about 5 to 6 centimeters. Allow for complete chest recoil. Make sure you're not just pushing on the top, that you're pushing down and letting the chest come the whole way back up. And they need to be on a firm, flat surface. So if they would collapse on a bed or a chair or they're in a car accident, we need to get them flat on the ground so that they have a hard surface underneath. For rescue breaths, we want to do the head tilt chin lift. You saw that in the video. If we suspect a head, neck, or spinal injury, you're going to do the jaw thrust where you just pull the jaw forward and try to open it without moving the neck. Create a tight seal. So you have a couple choices here. The one that you saw in the video is a plastic mask, but it has a filter in it. And these are pretty cheap. They have even little ear bands, so you can put that on them and it will stay. And that comes in, it just comes folded into a little pouch, so you can order those. And then I prefer this one. I keep one in my first aid kit and in the car. And this pops out. And these will protect you from COVID-19 because of the filter in there. It's not letting air come back out. You're just blowing through one way. It's a one-way valve and filter. So I would blow through here, and this triangle part goes on their nose like that. So that will protect you. You don't want to do mouth to mouth anymore. We don't do that, especially with the pandemic. So if you don't have a mask, you're going to do compressions only. So delivering 2 breaths and watch for that chest rise. If we don't see it, you can try to reposition and try your second one. But if the second one doesn't work, just move ahead. It means that they have an obstruction or an injury. All right, we're going to look at AED next, which stands for Automated External Defibrillator. And they're very easy to use. You turn them on, just put the pads on the chest, one on each side, up on the right, and then down on the left under the heart. So you're trying to make a diagonal line that would go through the heart for the electricity. And there would be pictures on the AED to show you the pediatric pads. There's 2 different sizes so that you make sure that you're using the correct one. So we're going to check out the AED videos.
For someone in cardiac arrest, calling 911 or the designated emergency number, starting CPR immediately, and using an AED as soon as possible gives the person the best chance for survival. Cardiac arrest can occur when the electrical impulses that cause the heart to contract rhythmically become abnormal, disorganized, and chaotic. The heart will stop beating or beat too ineffectively to circulate blood to the brain and other vital organs. 2 abnormal heart rhythms in particular, ventricular fibrillation and ventricular tachycardia, can often be corrected by defibrillation, the electrical shock delivered by an AED. When effective, the shock disrupts the abnormal electrical activity long enough to allow the heart to spontaneously develop an effective rhythm on its own. An AED is simple to use. The device will guide you every step of the way. AEDs can be used on people of all ages and can also be used on pregnant women. All you need to do is turn the device on and follow the voice and visual prompts. Remember, start CPR immediately and use an AED as soon as possible. For each minute that CPR and AED use are delayed, the person's chance of survival is reduced by about 10%.
All right, there's one more video explaining the AED, so we'll head towards that one next.
When a person is in cardiac arrest, use of an AED can help restore a normal heartbeat. If you are the only trained responder on the scene, turn on the AED as soon as it is available and follow the voice prompts. Once the AED is turned on, remove all clothing covering the chest and wipe the chest dry if necessary.
Attach pads firmly to person's chest as shown.
Using the appropriate sized pads, place one pad on the upper right side of the chest and the other on the lower left side of the chest below the armpit. Remember, you should not use the pediatric AED pads or key on anyone older than 8 years or weighing more than 55 pounds. However, adult AED pads can be used on a child if pediatric AED pads are not available. If the pads touch, which is usually the case with small children and infants, place one pad in the middle of the chest and the other pad on the back between the shoulder blades. Plug the pad connector cable into the AED if necessary and prepare to let the AED analyze the heart's rhythm. Make sure no one, including you, is touching the person. Say clear.
Clear.
In a loud, commanding voice. Be ready to deliver a shock if the AED determines one is needed. To do this, make sure no one, including you, is touching the person. Again, say clear in a loud, commanding voice. Push the shock button to deliver the shock.
Shock delivered.
After the AED delivers the shock, or if no shock is advised, immediately begin CPR starting with compressions. Continue giving CPR and following the AED's prompts until you see an obvious sign of life or EMS personnel arrive. If there are 2 or more responders, the steps will be slightly different. Responder 1 will continue CPR, while responder 2 sets up the AED. When the AED prompts, analyzing heart rhythm, responder 2 says, clear.
Clear?
Then the responders switch roles. Responder 1 will now operate the AED, and responder 2 will now provide CPR. The responder should switch roles in this manner each time the AED analyzes the heart rhythm. Notice how CPR and AED use are working together as parts of the cardiac chain of survival. When CPR is not interrupted to prepare the AED, chances of survival are increased.
All right, we're going back to the next topic, which is choking. So this is for adults.
Let the choking victim know you're going to help them. Wrap your arms around the victim and make a fist with one hand and place it above the navel in the middle of the belly. Hold the fist with your other hand and press forcefully into the person's abdomen and up toward the chest. Continue performing abdominal thrusts until the obstruction is removed or the victim becomes unconscious. If the victim becomes unconscious, lower them to the ground and begin CPR.
And there's some differences for infants. Take a look at that.
If an infant is conscious but choking, deliver 5 chest thrusts using the 2-finger technique, thrusting the infant against your forearm and thigh. Turn the infant over and deliver 5 back slaps. Continue alternating 5 chest thrusts and 5 back slaps until the airway obstruction has been removed. Make sure to support the infant's head and neck when delivering the chest thrusts and back slaps. If the infant becomes unconscious at any time, begin CPR.
Okay, so that's the big difference is we're doing abdominal thrusts for adults and children, which is anybody, age 1 and older. Infants, if you can hold them and they're still small, they're not old enough to walk, then we do the back slaps and chest thrusts instead of abdominal thrusts. So like I mentioned before, if at any time you don't have a mask and you don't know this person, we're not going to do mouth to mouth. So you're going to do hands only CPR. You might only choose to do mouth to mouth on a family member or someone that you really know, but you don't have to at all, and definitely not with a stranger. So you put your hands in the middle of the chest, and instead of counting and doing a ratio like 30 and 2 and checking for the respirations, you're just going to continue. So you can do it different ways. You can just do 2 minutes, set a timer, and then kind of take a break and check the breathing, but only a few seconds, and then go right back to it, or switch with someone. Or you can still count to 30 if you're used to doing that, but just start over, like get to 30 and then start over at 1. And you would do that 5 times, which will be about 2 minutes. And we'll get to questions in just a second. Here is the overview, everything that we've gone over so far. Chest compressions, rescue breaths, the ratio is 30 and 2 for adults. If you have an AED, just turn it on and follow the directions. And if we see someone choking, we encourage them to continue coughing if they're making noise. But if they stop making noise or stop coughing, then we need to ask if we can help and start with abdominal thrusts. Okay, I'm going to show you the website. And let's see. Yeah, if there was another question. Okay, so let me show you, if you haven't seen this before. This is our Save a Life website, savealife.com, and we're hosted by NHCPS, which is National Healthcare Provider Solutions. So to get your CPR, you click on your CPR, and then when you go to check out, there's a code that you will put in here that is it Datu will give to you, and you'll see that the price comes down to 0. So that's where you can take your CPR. And then here, let's get here. When you take the course, if you haven't done this already, you can see there's different modules. We just reviewed the CPR, AED, and choking just very briefly, but they have all of the other first aid and injuries and illnesses in here. And there's videos with each. And then at the end, you will take an exam. You need to get 80% to pass, and you can take it as many times as you want, and you can come back to it, and you can look things up if you want to. Once you are finished and you pass the test, then you will be certified in CPR, and that is good for 2 years. And you can print your certificate. They'll give you a digital certificate that says you're CPR certified, and you can download that and print it out. Also, make sure to look at the free resources up here. We have the different courses. If you're a healthcare provider, there's practice tests, mega codes, algorithms, and this mobile app is nice. This is free on your app store, and this has all the courses and all the algorithms, and you can look things up like first aid, or even in an emergency, you can look up what to do next. And then we have these ebooks you can download. They're all like 50 to 100 pages and a lot of information. So if you want to keep a copy on your computer or print one out, you'll have access to that at all the time. So any questions, if you want to type in the chat, or if you want to unmute, you can ask a question if you like. Okay, well, I will send the follow-up information, and then Datu can send that all out to you so that you have the website and the code, and you can practice and do your certification later. All right, well, thank you very much for coming.
Yes, thank you, Kim. Thank you. Thank you for accommodating us.
You got it. Okay, well, have a good evening. Bye-bye.
Bye-bye. Thank you.